80% of Americans will experience acne. It can be painful, embarrassing, and even scarring. With a little prevention and medical attention, it doesn't have to be. Acne is caused by overproduction of oil by the oil gland, hormonal activity, or bacteria buildup.
Comedonal acne is the most common type of acne that we typically see. It's usually the mildest form as well. So comedonal acne is a type of acne where you have plugging of the hair follicle by sebum or oil, leading to what we call whiteheads or blackheads.
Dermatologist Paul Friedman often recommends a salicylic wash.
Salicylic acid is a very effective ingredient to basically open up pores and exfoliate the skin. So for our patients with comedonal acne, we'll typically prescribe a vitamin A type cream such as Finacea, which is azelaic acid, which helps make the skin cells less sticky, opening up these plugged hair follicles.
For those who need immediate improvement, Dr. Friedman often injects intralesional cortisone into the acne region.
We'll typically use this treatment modality for any type of acne.
The second type of acne is inflammatory.
So inflammatory acne is typically caused by overproduction of bacteria causing acne, and it typically presents with red bumps on the skin or little pustular lesions, which typically looks like a little whitehead on top of the skin.
Megan experienced inflammatory acne since she was 12.
I went through, ups and downs. When I was 28, it like broke out all in my jawline. It was just like I was 13 again going through puberty. It was horrible.
Usually Dr. Friedman recommends a sulfur wash because it's antibacterial.
So for inflammatory acne, we typically prescribe oral antibiotics, which have two effects to improve acne. One is they reduce the bacteria that cause acne, and two, they have an anti-inflammatory effect. Typically, in combination with the antibiotics, we'll use a retin A product. Megan first presented to us with basically recalcitrant acne that wasn't responsive to traditional treatment modalities.
Because of the severity, she required laser treatments.
One advantage of this technology is it penetrates deeper than, say, a topical product can to basically heat up the oil gland, shrink it, and then reduce oil production, which is the root cause of acne.
Within the first treatment, I could already see the swelling going down, the inflammation, the redness.
She had a series of treatments at monthly intervals, and she had an excellent improvement, not only of her acne, but also of her acne scarring.
Before my husband, I would never let him touch my face. I was like, no, it's gonna, inflame or whatever, break out. And he was able, I was like, hey, feel this, it's smooth.
Dr. Friedman recommends another in-office treatment.
The blue light is an excellent treatment option for patients with inflammatory acne. The way it works is it targets the bacteria that causes acne, killing that bacteria, and then reducing active acne lesions.
The most severe form of acne is cystic. This is caused by the overproduction of oil, leading to a deep cystic lesion.
Cystic acne is the most difficult acne that patients struggle with, and it can be painful, it can be unsightly, it can severely affect a patient's self-esteem. We have several different treatment options for patients with cystic acne.
For hormonal cystic acne, women can often benefit from birth control to help lower androgen hormone levels.
Oftentimes for cystic acne, we'll also utilize antibiotics.
Patients should cleanse with a benzoyl peroxide wash.
It goes into the pores, kills the bacteria causing acne, and helps with inflammatory lesions as well.
Dr. Friedman also recommends a sulfur gel to decrease inflammation and kill bacteria, a benzoyl peroxide and retinoid topical treatment, and a product to help reduce scarring and discoloration.
I had acne as a teenager and did the whole Accutane treatment, and then started in my young 30s, went into this huge breakout again where it was real cystic acne all down here.
She presented to us with cystic lesions along the neck and jawline. We chose to utilize the smoothing laser. Once we improved her acne, we then followed with the Fraxel laser to improve the appearance of the acne scarring.
Whenever you go through acne, I don't care what age you are, you start experiencing acne and you see it on your face, and it's like, here's your self-confidence, and it kind of goes down here. If you have an option to do a laser treatment, you automatically walk out with improvements.
So it's important for any patients with acne to utilize a water-soluble, gentle cleanser to help remove makeup and oil and debris that we accumulate on our skin during the day.
Also, look for moisturizers that are non-comedogenic, meaning they won't clog pores.
It's especially important for patients with active acne or who are going through the process of treating acne to utilize a sunscreen, which will help minimize the hyperpigmentation after the acne lesions resolve. Dermatologists have a huge arsenal of treatment options for patients with acne, and it's important that you seek treatment early rather than trying to manage the condition on your own, because you want to minimize the risk of any scarring.
For more, go to livewellnetwork.com.